And welcome back. There is a dentist who is rapidly becoming known as the East Aurora area's leading dentist for people who want cosmetic dentistry. A dentist who provides expert care that leads to extraordinary results. Wow. That dentist is Dr. Robert Meisner joining us now. Good morning, Dr. Meisner. How are you?
Good morning, Jen. I'm fine, thank you.
All right, so let's start with Aurora Park Implant Dentistry and exactly what your practice does.
Well, Aurora Park Implant Dentistry is a name we really put out there because I do major implant reconstruction. I've been doing implant dentistry. I'm an implantologist since 1980. Long time. And the name of my practice was just Robert J. Meisner. So we created another name, which is actually the same practice, which is Aurora Park Implant Dentistry.
And so an implantologist does exactly what?
Well, a real implantologist does all the surgery associated with implants, whether that's placement of the implant itself, the bone grafting, the soft tissue grafting that's part of it, and also does all the reconstruction. So, you know, an implant is just a surgical device. It's a screw that goes into a person's bone to create a foundation for teeth to be built.
Now, here's what I've learned. A lot of times we think that's just for older people, but a lot of times due to injury, a younger person needs an implant also.
Absolutely. No, it's not only about older people. It's incredibly important and worthwhile for folks that have no teeth. But anytime you lose a tooth, it's really, really important that when the tooth is lost or extracted, that bone is grafted in place. If the tooth is just removed and the hole is left to heal, all the bone shrinks. And therefore, you may not have enough bone for implants afterwards.
So time is very important?
Time is important, and going to the right place. And if anyone out there has a situation where you're going to lose a tooth, make sure you talk to the doctor and say, are you going to graft afterwards? If they say no, ask why. And if they don't do it, then I would go someplace else.
Or just call you, right?
Or call me. Call me, absolutely, yeah.
There's different types of implants. Can you tell me a little bit about that?
There's many different brands of implants. But there are fundamentally implants that are screws that are wider, and there's one other type implant that's called a mini implant, which is also a screw which is very, very thin. Mini implants have very limited application. Now, I know people out there, some dentists may be saying, oh, that's not true, that's not true. But a mini implant is only 1.8 millimeters wide. That's like a finish nail compared to a common 16-penny nail that you use to put boards together in a house. They're not big enough to take load. So they're advertised as being cheaper, faster, easier. They may be a little cheaper. They might be a little faster. They're not easier, and they don't have the long-term results.
I'd like to choose the better one, the one that lasts.
You know, if you're going to have a heart replacement or a kidney transplant or a pump put in, you ask, what's the best way to give me the best results long-term? It isn't really, well, how much is it going to cost? What's the best result? And mini implants do not give you the best results in most situations. They have some limited application.
I know that knowledge is power, and people maybe learning about the procedure of dental implants will help. You're doing an open house?
Yeah, we're doing an open house next Tuesday. In my office. We have a nice space set aside, and it is at I think it's 5:30 if I'm not mistaken.
That's a good time.
Yeah, in our office setting, and it's a great time because it gives you a chance to ask any questions you want directly to me and to my team.
Okay, now I'm wondering, because I've never been through a dental implant or anything like that. Do people get put out, twilighted, or just numbed? How do you do it?
All of the above.
Oh, okay, so whatever you're comfortable with.
And you know, because I've been doing it so long, I think I'm the only doctor in Western New York that's had all that experience. We initially did it without any kind of sleep anesthesia. We did it with local anesthetic, and it was fine. People did not have a problem with that. But today, it's different, and we many times use, probably most of the time, for more extensive procedures, we use some sort of sedation.
Okay, a lot of choices.
A lot of choices.
Good information. Thank you for being here today.
You're welcome.